looks horrendously infected, but actually it's not. So these are a special crocodile forceps specifically for this job. The reason, in case you're wondering at this point, you may think, well, God, there's a lot of faffing around here, you know, with a hook and forceps and so on and so forth. It's basically, back in the early days when I first started doing these, I'll never forget, I pulled on the blue strings. So the patient needed, you know, the lyric had failed because it had gone wet. So I thought, you know what, sod it, I'll pull on the blue strings and just yank it out. Wrong thing to do, because this is very, very different to removing wax or plugs of dead skin. It's a very, very different skill set, because if you yank it out, you will cause horrendous pain, but also you will cause damage. So when you're removing a wet lyric like this, there's often a very, very fine balance between getting it out, but also getting it out in the sense that it's not going to hurt, and getting it out such that you minimize the damage, you minimize the trauma to the ear canal. And really, I mean, the worst that will happen is that you have hematoma. So you have bleeding underneath the skin, but you have really big hematomas. That you can get hematomas on the eardrum, or hematomas of the ear canal, which are so big that, which is a blood blister. So you have a blood blister which is so big it, you know, it obscures the ear canal. So here now we just have enough purchase on this lyric. I've skimmed around it enough times with this metal hook to loosen the seals. And if you're wondering why, you know, it was so kind of liquidy and oily, I did apply olive oil just because I was struggling so much. I don't know if that helped, but it's in the medical guidance from Phonak. You know, you can apply a lubricant, so not entirely sure if it helped or not, but